Dear students from all around the world, I'm Professor Özer Makay, representing the University Faculty of Medicine. Today I will give you a brief overview about our School of Medicine. The University Faculty of Medicine has been established 65 years ago, and walking in the big complex, you'll realize that you will walk in the footprints of our mentors. One of them is Muitinera. We have dedicated a lot of places to him, and as I said, you will just realize the history. The medical education started at 1955, so it's 65 years ago, and the first graduates came after 6 years. There were 20 foreigners in between. Starting of divisions and subdivisions happened in 1958, so it was 3 years after the establishment, and currently there are 44 departments, so we are talking actually about a big complex with a lot of divisions and subdivisions. Regarding the medical education, it has been carried by integrated medicine education. So it was classical education, and later on there was a paradigm shift to integrated medicine. But later on, in 2003 and 4, the system changed again, and this time we have updated the system with a vertical integration program. And using this new approach, this type of education offered by different departments of the faculty was reorganized with the framework of subject integrity. What we reach actually is a better understanding of medicine. Today, we are talking about why we should select our School of Medicine. So why should you be in Ege University? It's due to the outstanding educational and research opportunities. We have a big complex of 2,000 beds. As I told you, a lot of divisions, subdivisions which serve medicine to the community. So there are lots of things to learn. We accept top-level students from the one-person portion in the National University Examination. And our graduates are among the top list of the medical specialization exam. Our system enables students to receive both medical skills as well as lectures regarding basic and clinical sciences from the very beginning of the first year of their education. There are strong infrastructure opportunities starting from the first year until the last year. For example, during the first year, you will receive anatomy lessons with fresh cadavers that support your theoretical lessons. We have practices with microscopes, different types of microscopes, and medical skill practices throughout the 6 years. If we have to talk about the quality of our education, we are actually one of the first medical faculties whose education has been approved by the National Medical Education Accreditation Board. We are very proud of this, and this has been updated last year again. Through the scientific research activities and awards from national as well as from the international platforms, makes Ege University School of Medicine a leading research center in Turkey, as well as in the world. Here you will have the numbers of our professors to their residents. So we talk about hundreds of actually mentors who may guide you when you study at Ege University School of Medicine. Yearly we accept 350 students. Registered students today are 2,500, about 2,500. I think the most important parameter here is the student teaching staff rate, which is 6. It's quite a good number. Our teaching language is Turkish. We have to underline this. The duration is 6 years. And the most asked question, whether we have any integration to Erasmus Program, is a big yes. I will talk about it later on. One of our opportunities is the simulated patient lab, which you start to use in the very first year with your mentors. You improve your communication, history taking, physical examination skills with healthy volunteers. These volunteers act as patients. Our lectures is carried out in a simulated patient's laboratory, as I told you, during the first year of your education under supervision of your mentor. Another program is the special study module, which the student receives the second and the third years. Actually, I find it very educative and funny because vice versa, we learn each other something during this program. The students have the opportunity to make one-to-one practice with their mentors during this module. And the topics can be related not only to medicine, but also art, foreign language, or you may construct some social responsibility projects with your mentor. So actually it improves your skills regarding communication, time management, oral presentation, etc., etc. Another program which we are very proud of is the researcher training program. This program's purpose is to contribute to the training of the future scientists. So this actually means you have a project, you decide about the project with your mentor, and you are there from A to Z. So it's from hypothesis until making a manuscript and having it published. It's a very nice journey. I'm also in this program and I have students, and it's really during those 3-4 years, it's an incredible journey together with one of you. So it gives actually the opportunity to take part in scientific projects, and you make one-to-one practice with your mentor, and you learn what is actually a research from A to Z. We have student communities, and when you start on your first day, you will realize that all have some desks where they invite you to one of these communities. We have 17 communities working in different fields. It may be cinema, modern dancing, cycling, theater, music, any kind of music, or there is a scientific research community who can invite you to make research again. These activities aim to improve the social capabilities of medical students with cultural activities, and be sure that you will find places, the deanery or the rectorship will find places to do your cultural activities for presentations, for concerts, or whatever. I told you this is one of the most asked questions, whether we are in the Erasmus program. Yes, Ege University is a member of the Erasmus program, and a student abroad exchange program exists in our faculty. We have opportunities to visit Germany, France, Spain, Netherlands, Denmark, Portugal, Poland, Lithuania, Greece, and Bulgaria, and for the other countries where there are still negotiations. This is what we like to see. This is the graduation, a picture of the graduation ceremony at the end of the 6 years after when finishing your medical study. You become a medical doctor through a traditional graduation ceremony. I think it's one of the most days of the last year, maybe of the 6th year. What is it possible to become specialized in a field? Of course it's possible. The general practitioner graduated from the Faculty of Medicine can continue the primary healthcare service for any period of time. You may work as a physician in community health centers, family health centers, or emergency departments as a GP. A GP who wants to specialize in a special field has to attend actually a centralized exam, which is called the Specialization exam in medicine. We call it TUS in abbreviations. Is it possible to become an academician? Of course, this is hands off to you as well. You can continue your research in the medical faculty and step into academic life to be an assistant professor, associate professor, and a professor. But the steps which we are leading to these titles, you will learn it during your 6-year education. I try to give a brief description of Ege University School of Medicine. I hope you enjoyed it, and thank you for listening.